Okay. Well, as I said, thanks so much for joining us this evening, everybody. Really, it's quite an exciting event. We've got Jenny Boyce, physiotherapist, joining myself, Tamika, who's an exercise physiologist. I'll introduce us both a bit more closely in a minute. But just before we begin, I just want to respectfully acknowledge the traditional owners and custodians of the land in which we meet today. I also acknowledge that we have a number of parties joining us on Zoom from lots of different regions across Australia and Queensland. So I just want to acknowledge the traditional owners and custodians of those regions and pay my respects to elders past, present and emerging. And as you might have just heard, we are recording our video tonight. So completely fine. You can choose whether you have yourself on camera or not on camera. We'll assume you're listening away either way. So we'll see how we go from there as well. Okay. All right. So yeah, really excited about this evening. Jenny and I are both local to the Albany Creek area. So Jenny practices her physiotherapy practice and I'm an exercise physiologist as well. So really I'm very passionate about working with women's health, or both of us are as well, and certainly helping women get the most out of life at their different unique phases of life and the different challenges that come across through that. Really, both of us have a very holistic approach and really believe in empowering you to really get the most, out of and take charge of your health as well, which is why we're so passionate about doing community education things like we have today as well. Before we continue, just want to hear a little bit about you guys. So we've already learnt to use the chat function, which is awesome. So just tell us where you're at in your endo journey. So have you got symptoms? Have you been diagnosed? Or is someone close to you have the condition? Or maybe you even just want to know a bit more because you've been hearing this endo word a lot this month, being Endometriosis Awareness Month as well. If you just pop something, about where you're at in the chat room there as we go along as well. Now, while everybody's doing that, I'm just going to go through what we're going to cover for this evening's talk, so what you can kind of expect as well. Really, a big part about it is understanding the condition, because we kind of hear this word get thrown around a lot, but we don't really understand the processes behind the disease and the effect that it has on all the other systems of the body as well, including the inflammatory side of things. And we'll talk a lot about that tonight too. And then looking at the other side of things, which is the management. So you're looking at a multimodal pain management approach to managing endo. And you'll hear us call it endo a lot, and we're talking about endometriosis. So we're looking at lifestyle management, including pelvic floor physiotherapy, exercise physiology, stress, and sleep, and how we cover those kind of areas as well. Awesome. Thanks to those of you who are already popping things in the chat about, you can see we're all kind of coming from different backgrounds there. Some have some symptoms, some know people who have symptoms, and we'll learn very shortly just how prevalent the condition actually is as well. I think we've got more people joining us. Awesome. So starting with what actually is endo or endometriosis. So really it's a progressive chronic condition and actually affects 1 in 9 women of reproductive age in Australia. So it's super common, and that actually ends up being about over 1 million women in Australia that are suspected to have this condition. It's where the cells that are similar to those that normally line the uterus, which is called the endometrium, it's when those cells are found in other parts of our body. Okay, and we'll talk in a moment about that can be pretty much anywhere as well. So the presence of those cells where they don't belong kind of just can distort the body's anatomy, and it ignites an inflammatory response. And this increases the likelihood of autoimmune dysfunction and disease as well. And there's a big cascading chain of reactions that can occur from this, which can affect the physiological functioning of the body in a lot of other ways as well. Now, we'll see the most common sites for endo in the ovaries and the fallopian tubes. The lining of the abdominal cavity, which is what we call the peritoneum, can also be found outside the uterus and in the ligaments that hold it in place. So really all around that kind of pelvic region that we sort of expect. But it can also be found between the rectum and the uterus. It can be found on the bowel and the bladder, in abdominal surgery scars, and actually, whilst it's rare, it can be found on organs outside the pelvic area as well. We've even heard of a case of endo being in the heart and endo being in the nose too. So you can see in some cases you can have really obscure locations, and that's why just looking at just the pelvic area in itself can often miss a few of those other symptoms too. So really, endo can occur anywhere in the body, which is why so many different bodily systems can be involved, and the symptoms can be so different between everybody as well. So if we look a bit more closely at the symptoms, you can see there on the image, really can be quite broad as well, but pain is definitely a common theme. When we talk about pain, this can be, period pain that's not relieved with medication. It can be painful sex. It can be pain during, before, or after your period. It can be back pain, pain in the legs, pain in the abdomen. The pain can get worse over time. And it can be really severe pain to the point where you can't participate in your day-to-day activities as well. And then we're looking at bleeding as well, which you'll see up there too. So, this is heavy menstrual bleeding that we're talking about, and it may contain clots as well. It can also be spotting and bleeding between your periods as well, or having blood even in your urine as well. Now, some of the other symptoms for endo we look at is irritable bowel syndrome, or other kind of gut issues, which we'll touch base on shortly. Also, fatigue and lethargy, so really extreme tiredness or feeling faint. And then there's the psychological side of things too, where we can get mood swings, where you can feel depressed and anxious and irritable. And then it does affect fertility as well, which we can go into detail on shortly as well. So just want to really help you guys understand the disease process that goes behind this as well, because like I mentioned, the underlying mechanism here is that the cells that are typically found in the endometrium are located in other parts of the body where they don't belong as well. So what happens is these cells that are found outside the uterus, they're still stimulated each month by our usual hormonal cycle, but these cells don't have an escape route, as in they don't menstruate, they have nowhere to go. So because they have nowhere to go, these cells still get thicker and thicker each month. And in time, this can start to distort some of the surrounding anatomy around the area as well. And it can actually cause organs to start to stick to one another. So you might have the rectum sticking to the uterus or something similar as well. So now you can see how when this starts to happen, it becomes its own mechanism for pain as well. And the pain starts to get quite complex. So as the thickening kind of continues as well, they actually need their own blood supply. So this has an impact on our central nervous system because they're continuing to multiply and expand over time. And this is what we mean when we say that it's a progressive condition as well. And then when we have nerve supply buildup, the nerve density bulks up, which means that we have more sensory signals. It means that there's more sensitization of our nervous system, which actually means that what started off as quite a simple thing is now affecting a lot of different symptoms, and we can actually experience pain earlier than we would have otherwise as well. So hopefully this starts to just get you thinking about how endo is such a systemic and such a chronic condition that can affect so many different other parts of our body as well. Now, Jenny's going to touch in a moment about the different co-conditions of endo. We call them co-conditions because, as I've just described, this starts to affect a lot of other different systems in our body as well. And it's for this reason, because our medical system is so super specialized, so everything's kind of in its silos. What happens is, and I don't know, those of you who have endo might be able to attest to this, but we end up on this misdiagnosis roulette, we call it, where you're kind of bouncing around potentially between different specialists, trying to get your bladder symptoms sorted out, or your gastrointestinal symptoms, or your back pain. You might have even seen a physio or an EP for your back pain in the past. And really, we need someone to kind of look at this all holistically and put the pieces of the puzzle together when it comes to managing endo as well. Now, the other thing I just want to touch on is the fact that 57% of women with endo also suffer from allergies. So reactions to pollen and the incidence of asthma and eczema, so you think they're our three kind of allergy type things, they are much higher among people with endo compared to the whole population, which is just something that's interesting. And what it does tell us is that women with endo have a very highly responsive immune system. It means that we're more likely than normal of developing different autoimmune conditions. So that can be things like Hashimoto's, celiac disease, rheumatoid arthritis, eczema, and a lot of those other ones as well. So if you are somebody who does experience some of those things and you're kind of, querying as to whether you might even have endo in the first place, that in itself can be a bit of a sign that you might have as well. All right, I'm going to just pass over to Jenny now. So I'm going to bear with us as we practice our technology skills. I'm going to stop my share and we'll swap over to Jenny, who's going to touch on the next part of the presentation.
Well, good. Okay. All right. Well, welcome everyone. As Tamika said, it's really great to be able to chat about endometriosis to you. So Tamika was just mentioning about the fact that, there can be this misdiagnosis roulette that that patients go around. And this is partly because there's been a limited number of diagnostic tests available to easily diagnose endo. So traditionally, laparoscopic surgery has been the only way to confirm endometriosis tissue is actually present, which is where they do keyhole surgery via the abdomen, performed under general anesthetic. So, it's a fairly invasive diagnostic test. Research actually currently is working on more non-invasive diagnostic tests, such as some new specialized ultrasound to find features of endometriosis. But this does require expert training. So what we are suggesting is that it's really important to make sure that your GP requests a sonographer who actually specializes in endometriosis diagnosis. So definitely, if you're wanting an ultrasound scan, definitely ask for that. And the other thing to know is that MRI scanning is currently being investigated, and yeah, we're just going to watch this space to see how that comes along. But endo is very hard to diagnose, and I say research at the moment is really looking at finding better ways to do that. So we found that with laparoscopic surgery, we can sort of stage endometriosis and classify it into minimal through to severe, or stage 1 through to 4. And the American Society for Reproductive Medicine has looked specifically at this. So with stage 1 being just very small endo patches or plaques, very mild inflammation, mild adhesions, all the way through to stage 4, where we're looking at really significant severe implanted endo patches, scarring, a lot of adhesions in other organs such as bladder, bowel, between the uterus and other organs as well. So staging really is based on the location and the extent and the depth of endo tissue seen during surgery. There. Okay, so what I'm going to look at, Tamika mentioned that we'd look a bit more closely at the effect of endo and pain on our bodily systems, other bodily systems. So what we find is that our pelvic floor muscles can present as very tight and tense. And we find that women who experience pelvic pain often present this way, and it's almost like the pelvic floor muscles are tightening up as a coping mechanism to try and protect the pelvis there. So often these pelvic floor muscles find it hard to relax, and it can lead on to other sensitivities. So and other symptoms basically across the other bodily symptoms. So often we find that the nervous system itself can become sensitized. And so some people actually present to their GP more with symptoms like fibromyalgia, IBS, chronic fatigue, even jaw pain, restless leg syndromes, headaches, chronic headaches, multiple chemical sensitivities, a whole range of symptoms, lots of diffuse pain, that seems to flare very easily. They're worried about moving, and they may sort of cycle into lots of other issues associated with that. In addition, there can be some gastrointestinal tract symptoms, difficulty and pain passing a bowel motion, for example, or a sense of incomplete emptying. Constipation, diarrhea, swinging between the two, so more of that IBS type symptoms, and bloating as well prior to periods, between periods. So that can be really uncomfortable to manage. Bladder, in terms of the bladder symptoms, again, difficulty and pain to pass urine, often presenting with urinary irritation and urinary frequency as well. As Tamika mentioned earlier in one of the earlier slides, people can present with, women can present with pain or difficulty having sex, pain after sex, right down to pain and difficulty using tampons, having a vaginal examination, not necessarily wanting to go for their cervical screening tests or pelvic ultrasound scans if that's been requested too. So on top of that, we have the musculoskeletal pain presentations, which include back, abdominal pain, leg pain, so in more around the groin and inner thigh, the buttocks as well. So lots of pain radiating into these areas. So we just wanted to touch on the fact on how endometriosis can affect fertility. And we know that 30% of women with endo will have trouble to get pregnant, but most women will become pregnant without any medical assistance. There are treatments available, so what we really suggest is that it's important to chat to your GP or fertility specialist about how endo might affect your fertility if you're in that childbearing age range sooner rather than later. And that sort of leads on to the fact that early diagnosis we do really value, and it is a common theme through the thread through our talk tonight about if you think you have endo, you're presenting, you're seeing, you're experiencing these symptoms, that you do chat to your GP earlier rather than later. And what we find is that sometimes a symptom diary can be really helpful, because it means that you can take this to your GP or your gynecologist so that they can help you find out what's wrong, help you get the most out of your medical appointments as well, because we can find that, often we're short of time in those appointments, and so you really get the most out of them. So Jean Hales for Women's Health, which is a wonderful women's health organization. You can actually download a PDF copy of a pain and symptom diary, which looks at, in particular, your period pain, other types of pain, other symptoms, family history, all that sort of stuff that you can actually put down. And even if you're finding it difficult to even chat to your GP about this, you can even just present this to them, and that will bring up lots of conversation starters there too. Okay. So yeah, we find that if we go back, symptoms are so variable. Often they are considered quite normal, and sometimes they are asymptomatic though as well, these symptoms, but we really find that we're getting the best results out of women who are getting early treatment with it being such a progressive disease. Okay, We're going to pause on endo for a moment and actually now look at adenomyosis, I apologize, and just want to highlight this condition. It is different to endometriosis, but can present fairly similarly. So adenomyosis is a condition of the uterus or the womb. And it's where cells similar to the lining of the inside of the uterus also present in the muscle wall of the uterus, so the endometrium. And many women will have both conditions. They'll have both adenomyosis and endometriosis. So as we can see on this slide, adenomyosis signs and symptoms are very similar. We get those painful periods, heavy periods. As a result of that, we can experience anemia or iron deficiency, tiredness, dizziness, painful sex, chronic pain conditions. So yeah, so there's a whole range very similar to endo. On examination, if a GP is doing a vaginal examination, the uterus does present as quite bulky and tender, so that can be a diagnosis tool. It can be very difficult to diagnose, though. Similar to endo, there's no single set of tests or blood tests that can be done there, but they are starting to use more of the transvaginal pelvic ultrasound, some MRI. It can be sometimes that it's not until after hysterectomy that adenomyosis is actually diagnosed. So the woman is told at that point, oh, you had adenomyosis. Management really does depend on the woman's symptoms and the impact on their health and quality of life, what sort of stage of life they're at, whether they're planning on future pregnancies. So there are a range of non-medical options. We're going to see that this is very similar to endometriosis management. And there are some medical options available in terms of non-hormonal as well as hormonal, as well as surgical management strategies there too. Okay. All right. So I'm now going to stop my slideshow and hand back over to Tamika. Okay.
Thanks, Jenny. Just bear with me, everyone, for a second. There we go. So really, the second half of today, and probably the most important for a lot of you, is going to be how we manage endo as well. So it's all well and good if we know all the information about the condition, but it's about, what can we actually do about it, I think, as well. Now, to start with, because pain is such a prevalent experience, I think it's really important that we start to understand pain a little bit as well. Now, pain happens in our central nervous system. So this is the brain and spinal cords kind of area as well. And knowing that that system has two tasks. Basically, it takes up all that sensory information that we give it, and then it has to respond with some form of motor instruction to the body as well. So when we experience pain, what we get is that sensation of pain. It arises from a stimulus, which might be some kind of potential threat to the body. We have these nerve endings called nociceptors, which basically detect this stimulus, send it up, sound the alarm of it being a possible danger to the body as well. So we can kind of think of this process as nociception rather than what we normally say as pain as well. So basically this sends a big process. The body and the brain has to kind of take in all the different information from the other parts of our body too. It's saying, oh, have we been here before? Is this something that, we've had a bad experience with before? And basically the brain has to make a decision as to whether this is something that we're going to react to or whether this is something that's actually dangerous for us as well. So when the brain decides that, and that basically determines our response as well. So the brain has to take in the nature of the stimulus, the intensity of the stimulus, our past experiences as well. And I suppose the point that I'm trying to make here is that our emotional and behavioral response to a certain situation affects our pain experience the next time we might experience that same kind of stimulus as well. So this could be something like, when we touch a hot stove and we immediately pull our hand away from the stove. But in the case of endo, it's, usually if we feel pain or discomfort in our abdomen or our pelvis, your body might tell you to kind of curl up into that fetal position and maybe subconsciously guard against that pain by tensing your abdominal muscles and your pelvic floor and potentially even some other parts of our body as well. So that in itself could be the way that your body has, you know, your brain's trying to protect you from that stimulus, and that's its way of doing so as well. So we know that a pain can be acute, so it can last for a short time, but sometimes this continues to happen to the point where if it's left unmanaged, it can become what we call chronic or persistent pain. And that's pain that lasts well beyond the expected time for healing, whether that's surgery or trauma or for some other reason as well. As we've discussed, the implications of this amplification of the nervous system, when that happens a lot of the time, you can see how the body then just becomes kind of automatically knows how to respond in that same way next time. And we build up this, chronic pain and persistent pain over time as well. So this is a process which is called sensitization. You might have heard of that term before, but it's where the original source of that pain turns on additional pain pathways in that central nervous system, and the body can become so sensitized that it's actually only needs a very small stimulus in order to still generate that same pain response. And you can see with endo, as that condition is progressive as well, you can see how all of this just kind of amplifies up as well. The really important thing to note as well here is that pain it's quite a subjective experience. So the brain, like I said, it takes into account all those different factors to determine what our outcome should be as well. So it's now clear that we have to operate in a model such as this. So our old medical model way of looking things, is purely biological. Pain equals tissue damage. We now know that that's not the case at all. We have to take into account these other components. We have to take into account the interpersonal factors, the psychological factors behind all of this, and it's just about looking at the person as a whole, because every single one of you, your pain experience is going to be completely different to one another. And it's really important that when we move forward and looking at our management model, this is what we're operating under. So today we're proposing an integrated multimodal approach, which basically where our goal for managing endo is to downregulate the central nervous system. I often like to use the phrase control the controllables with this, which is where, we're going to cover these 4 pillars of our health and things that we have control over with managing endo. And it's important to know, we'll touch on surgery in a moment, but it's really important to know that even with surgery, that won't stop the desensitization of the nervous system. And so we still need to look at these factors, even if you have had surgery. And even if you are looking at having surgery, these factors can actually give you better outcomes from that surgery as well. So I'm going to pass back to Jenny. We've got one more swap over between us. You're still muted, Jenny.
Okay, let me just share. That's better. It's just trying to find the right spot for a moment. Okay, so yeah, we thought that it would be best before we look at more conservative management strategies to just touch on surgery and the different types of surgery that are associated with endo management. So I've mentioned about laparoscopies already in the diagnostic side of things, and it is I suppose the most common type of surgery performed. It's not just for diagnostics though. So they are doing laparoscopies to try and remove endo too, and reduce pain and preserve fertility. And the goal really of surgery is to achieve the best outcome. It's not, what they're trying to do is reduce the need for further surgery in the future. It is really important to choose a surgeon with advanced laparoscopic surgical skills in endometriosis. So that's really important to recognize. There's usually two ways that they will try to remove the endometriosis. That's via excisional surgery, which is where they remove the endometrial tissue using cutting technique. Otherwise, ablation surgery is used, which destroys the endometrial cells using what we call diathermy. Okay, so the preference is as to which one they use is dependent on the surgeon itself. Laparotomies are open incisions, so and that can be for more severe endometriosis. They really try hard to keep it at keyhole surgery level, though. If endo has grown on the in the bowel, then or in the bladder, then often the gynecologist will also work alongside a bowel surgeon or a urologist as well. So they'll do combined surgery together. A hysterectomy can be performed, and that is where they're actually removing the uterus, plus or minus the fallopian tubes, plus or minus the ovaries. That's really performed for extreme cases, though, and they really are looking at the individual as to whether they have completed their family or not. So that's important to understand. And usually a combination of treatments is done, so surgery and hormonal therapy before surgery and after surgery as well is often combined there. Okay, let's move on to pelvic floor physiotherapy. Okay, so what I should mention is that in Australia, pelvic floor physios are known by quite a number of names. So I'm just going to let you know about that. So we can be known as pelvic floor physios, pelvic health physios, women's health physiotherapists, continence physiotherapists, women's, men's and pelvic health physiotherapists, and finally physiotherapists with a special interest in women's, men's and pelvic health too. So lots of names interchanged there. Interchangeable there. So we are physios who have specialized training in the management of problems involving the pelvis and everything that's inside the pelvis as well. So including the bladder, the uterus, the bowel, the pelvic floor muscles and the nerves as well. So we really try to provide a holistic approach. Tamika's already mentioned that, supporting the patient to improve their overall well-being, and really try and provide tools for self-management as well. So we're looking at, as you've probably been reading with the slide, providing strategies to reduce our pain, optimize our pelvic floor muscle function, improve bladder and bowel health, sexual health, and really encouraging and working alongside the exercise physiologist to find the appropriate physical activity for that individual. We also do look at relaxation as well, not just for the pelvic floor muscles, but also for body and mind too. And we are always looking at ways to liaise and refer on to appropriate healthcare professionals if we're finding that there are some concerns with dietary habits, emotional health, sleep concerns, that sort of thing too. All right. So pelvic floor anatomy. What I want to do is I'm going to stop sharing the slides, and I'm going to bring over my pelvic model so that we can talk through the anatomy of the pelvic floor and give you a really good three-dimensional view of the pelvic floor. I often find that's the best way for everyone to understand where the pelvic floor is and what the function of the pelvic floor is too. So I'm just going to stop sharing here. Is this working? Am I showing up quite big now? Yep. Okay, thank you. All right, so you can see here I have my model of the pelvis, okay, and I'm just going to point out some bony landmarks so that you understand, so you can sort of visualize it on yourself as well. So right at the front here, we have our pubic bone, okay, if you can see that just here, and then at the back of the pelvis, we have our little coccyx here, all right, so our little tailbone. And then either side, we have our sit bones or ischial tuberosities, they're called. So we've got front, back, side, side, yeah? And that whole area is where the pelvic floor sits. So if we're looking inside, we start to see the deep layer of the pelvic floor. And we can see that it actually attaches on the inside of the pubic bone here, and then wraps itself around between the ischial tuberosities, between those sit bones, to come and attach at the coccyx at the back there. Okay, so that's the deep layer of the pelvic floor that we're visualizing there. It's horseshoe shaped, it's also hammock shaped, so it's really taking up a large space and is the floor of the pelvis. From the underside, we actually start to see where the superficial layer of the pelvic floor is, okay? So that's this area here. So much smaller layer, much more on the outside, okay? So we have the three openings to the pelvic floor. We have the urethra, okay, that's where we wee out of. Here's our vaginal entrance, and then we have our anus at the back there too. All right, so and what we're seeing here is that deep layer of the pelvic floor now, tucking up and inside there. Okay, so if I just go back to sharing the screen. All right, so in terms of the function of the pelvic floor, it is to provide support to our pelvic organs, to our rectum, if you can see this. To the vagina, the womb, and the ovaries. So this model's showing all of it together. And to the bladder at the front there. There's our bladder. There's him there. Okay, so we can sort of see how that pelvic floor is helping to support our pelvic organs. It offers control to the front passage and the back passage, so to bladder and bowel control. It's involved in sexual sensation and function, and is also part of the core muscle group as well. Okay, so there are many people who aren't really necessarily sure of what pelvic floor physios do or what their appointments actually involve. A lot of women will be quite anxious about attending pelvic floor physiotherapy. So I thought it'd be worthwhile just letting you know what an appointment usually consists of. Certainly the initial appointment, we ask lots of questions, okay? So often they're quite intimate questions, but they're all very relevant questions, asking about your bladder and bowel health, any gynae history, obstetric history, sexual history, exercise, even down to the types of jobs that you do. Are they standing jobs? Are you active? Are you more in a sitting admin role, that sort of thing? And whether even down to, are you having to care for anyone at home too? So a little bit about your social history there. So what we're trying to do is really build up a really good history, understanding of your symptoms. We might use questionnaires, screening tools even before the first appointment. We might send them out or give them to you to take home. We'll look at diaries in terms of maybe ask you to complete a short bladder diary or a bowel diary, pain diary, that sort of thing too. Really just building a good history and developing good patient clinician rapport there as well. So very much interested in what your goals are for attending physiotherapy, both short and long term. we use this time also to, well, as you know, with listening to your symptoms, helping to validate your experiences. Tamika mentioned earlier, but that we can spend a lot of time moving from one clinician to another, sometimes getting fobbed off, sometimes not being recognized for what our symptoms are. So yeah, using that time also to validate the pain experiences and the symptoms that you have been experiencing. So we use even the very first session as a time for education, really recognizing that that can be so empowering to the individual. So talk about the endo disease process. Pain education is very, very big, and we discuss that right from the beginning. We talk about different treatment techniques that we can do, and even in that first session, try to provide some self-management for the individual to take home and start to use. So really looking at that self-efficacy right from the start. Now, another reason women can be anxious about attending pelvic floor physiotherapy is the idea of having to have a physical exam, particularly if examinations are uncomfortable for the individual. So it's really important to understand, and this is a big part of my appointments, is that I make sure that women have the opportunity to decline examinations if they want to, whether that's their first appointment, at the second appointment, fifth appointment, whichever one. Do it definitely explain why physical exams can be of great benefit as well, but we can just start with external examinations and then general observational examinations, and then if people feel comfortable and consent, then we can move through to internal examinations as well. So what we're really looking at doing there is assessing the pelvic floor function, so looking at the pelvic floor musculature in terms of tone, range of movement, the ability to contract and relax this pelvic floor muscle group. We need this to be functioning really, really well. Any pain in the muscles, and any trigger points that we can look at managing there. So in terms of pelvic floor muscle treatment, let's say we're really looking at addressing any pelvic floor dysfunction that is present, and often we're finding that these pelvic floor muscles, as mentioned earlier, do tend to be quite tight, painful. So the emphasis is actually on down training the pelvic floor muscles. Some people may know the term reverse Kegels. So it's not that we're trying to strengthen these pelvic floor muscles, but instead we're looking at trying to release and teach these muscles how to relax more easily, and therefore have better ability to be useful to us, because we need these muscles to be able to contract, to offer continence control for coughing, sneezing, that sort of thing, but they also need to be able to relax comfortably as well, to be able to relax for defecation, for voiding, and certainly for sexual activity and any examinations taking place too. So we use a combination of management strategies, looking at stretches, gentle movement, I say actually prescribing pelvic floor relaxation exercises, doing self-scanning, learning mindfulness techniques, diaphragmatic breathing techniques, some massage, and myofascial therapy, so more manual techniques can be done externally and internally. And then we move into things like dilator therapy, pelvic one therapy, which I'll talk about on in a few slides' time. We have something called biofeedback therapy, And we can't forget about the use of TENS machine, which is a non-invasive form of pain relief. And I'm going to let you know about a useful link that you can go to at the end when we look at resources and things like that too. Okay, so in terms of other management that goes alongside medical management, that goes alongside physio, there is the use of medications, and certainly this is another area of research that's been looked at the moment as ways to try and reduce those pain triggers. So we aren't prescribers, so this is only something that can be prescribed by GPs or gynecologists, but there are some oral and topical medications available for pain management, and the use of Botox as well. It's a very highly specialized area, but they are now using Botox injections into tight, painful pelvic floor muscles. And what this does is it actually creates a window of opportunity for pelvic floor management to take place. So if these muscles are in a more released state, then we can start to use other strategies to try and help settle this the whole system down, and so that can be useful. Botox doesn't last forever. It can last for around 6 months, so some people do need further Botox, but some people, a lot of women find that just one session of Botox is sufficient for them. Yeah. Okay, we can't forget when we're thinking about pelvic floor physiotherapy that we are always looking at ways to optimize our bladder and bowel function as well. This slide is just showing the sort of things that we're really discussing with you right from day one, looking at understanding what healthy habits are. So in terms of fluid intake, what we expect, so 1.5 to 2 liters of fluid a day. More if we're in hot weather, exercising, that sort of thing. But we don't need to be, for our intake to be too high either. So we want to get that nice balance there. We'll discuss stool manipulation options as well, just to try and optimize that stool consistency. And very much we're looking at positioning techniques for both bladder and bowel emptying there too. And for those women who are presenting with bladder irritation, urinary frequency, then we also look at some strategies to try and manage that as well. So this slide does show you examples of dilator set as well as a pelvic wand here. So these devices can be used by the individual as a self-management strategy, so in terms of the dilator set, you'll see that it is a progressive set of either plastic or now often silicone material. Dilators are very popular, and so they're progressive dilators, and you start with the smallest ones and then move upwards progressively, really looking at ways to help gently stretch and release these pelvic floor muscles so that they have the ability to move through range so much more comfortably, and they can allow the woman to gain more confidence in moving towards using anything from tampons to having a more comfortable cervical screening test, vaginal examinations, through to more comfortable sexual activity as well. And pelvic wands also are really looking at targeting specific areas of the pelvic floor to be able to do self-management in terms of massage techniques and trigger point therapy, that sort of thing. Okay, I'm going to hand you back to Tamika now, who's going to talk more about exercise management. This is where physios and exercise physiologists tend to cross paths as well. So, and I'm going to let Tamika continue.
Beautiful. Thanks, Jenny. You can really see how that's just absolutely Jenny's bread and butter. There's so much to it. With all those management techniques as well, and definitely the movement and the exercise we both share as our bread and butter as well. And when it comes to managing endo, it does play a really important role. I really love the image on the left there, that if exercise was a pill, it would be the most prescribed drug on the planet for so many different reasons as well. But when we're looking more specifically at endo, we're looking at symptom management. And as we've talked about, there's a huge variety of symptoms, but some form of movement or exercise does have the ability to manage just about most of those symptoms as well. So we're really aiming to increase our anti-inflammatory and our antioxidant markers, looking at estrogen, helping to manage inflammation and release those endorphins that help with the pain side of things. And then, as Jenny's beautifully talked about, managing pelvic floor dysfunction as well. Diaphragmatic breathing is a big one, which both exercise physiologists and pelvic floor physios will go into, and we will touch on, stress as a whole factor in a moment as well. But it's really about viewing exercise as restorative. So, focusing on length and strength, and thinking of motion is lotion when it comes to exercise. There are a few of the ones that we like as well. We're not looking at really high impact activity that's only going to further, stimulate and sensitize the nervous system. We're looking at restorative exercise. So it can be things like yoga, other kind of meditative stretching sort of exercises. It's not necessarily going to be, even things like Pilates. We're not necessarily looking at doing heaps and heaps of Pilates, because if we're just trying to strengthen and tighten core muscles that are already cranky and need to be lengthened, then we're not helping ourselves either. So you can see exercise is a really important factor, but not all exercise is the same when it comes to managing endo as well. Now, when we look at how much activity we need, now there's no specific guidelines that are specific to endo, but the research shows that we just are trying to, meet the physical activity guidelines that are there for the general population as well. So when we're looking at aerobic activity, so that's anything that gets your heart beating faster, really, we're looking at least 150 to 300 minutes a week. So that's, where you get a bit of puff, but you could still have a conversation with somebody. So it doesn't need to be very high and vigorous. And we're just aiming for that spread out over the week. It ends up being about 30 minutes on about 5 days a week, that sort of thing. And then we want to couple that with our muscle strengthening activities. So that's when we're doing things that make your muscles work a bit harder than usual. This is saying at least 2 days a week. The guidelines are at least 2 to 3 is the optimal amount. And we know that that's important just in maintaining our overall health, as well as, like we've talked about, managing endo itself as well. And really, the guidelines say doing anything is better than doing nothing. So starting small and building up progressively is the key factor here. We're not wanting to throw you into an elaborate exercise regime. It's about building that up nice and slowly. And we use a term a lot called graded exercise therapy in exercise physiology. So that's really where we're doing that progressive overload. We're giving your body time to adapt to the stimulus that we're giving it, and confirming that you are tolerating it well before we continue to build that up. But we are building it up in a progressive way, and that's where we start to really see the benefit for things like endo as well. So to give a bit of a background as to what an exercise physiologist actually is, other than being a bit of a mouthful, we're university qualified allied health professionals. We're really the experts in using exercise as a medicine for managing chronic disease and different musculoskeletal issues. So we prescribe exercises that are safe and that are tailored to your specific needs and abilities. And when it comes to endo, having somebody who specializes in women's health and is passionate about that, like Jenny's talked about in so many other ways, can be a bit of a game changer, because they need to understand you and your condition and what's actually going to be best for you as well. The other factor that I wanted to mention there as well is that we'll work very closely with your allied health team as well. So, you know, Jenny and I would work very closely together with different clients that we have. Really, in order to get the best outcomes, we need that multidisciplinary health team, and we need to all be working together in order to give you the best outcomes as well. So that's kind of the movement side of things. Now moving on to stress management as one of our pillars here. And in order to understand stress, we have to understand our parasympathetic nervous system. Now, you might have heard that term before, but really it's a component of our peripheral nervous system, and it controls the automatic sort of processes that happen in our body. So that's things like breathing and digestion and just things that we do involuntarily as well. And we can see we've got the two different zones here. So we've got kind of our parasympathetic is what on the right there. It's what we call our rest and digest, or it's the green zone is what I like to call it. So think, you know, calming sort of part of our nervous system. Then we've got the red zone on the left, which is our sympathetic nervous system. And that's our fight or flight kind of response that we have. So we're kind of constantly shifting and working between those two different nervous systems as well. Now, if we want to zone in a little bit on this red zone here, so understanding that red zone is our stress response, okay? So we've got lots of different effects that this has in our body. We know that our digestion slows down, but our breathing and our heart rate gets faster as well. You know, that's our body's natural primitive response to danger, whether that danger is real, or like a lion chasing us like it used to be, or whether it's perceived danger, like we just got cut off in the traffic and that really annoys us. You know, it still stimulates the same stress response as well. So knowing that, you know, as our society has changed, so too have the things that put us in the red zone. And in fact, there's more of it. So we spend a lot more time in this red zone, which, as we're about to see, it has a lot of negative health consequences as well. Now, I've just put here the stress hormones as well. So knowing cortisol and adrenaline are our main stress hormones. So when we're in that red zone, we have a really big production of these hormones. And our other hormones of our body, our reproductive hormones, they don't really like cortisol and adrenaline very much. So when we start to produce too much of these types of hormones, it starts to affect our, you know, the natural hormonal processes in the rest of the body as well. Now, when we're looking here about stress over time, so this is when stress has been happening for a long time, we get a decrease in things like our digestion, our immune system, and our reproductive and thyroid systems as well. We're also more likely to have allergies, IBS, PMS sort of symptoms as well, and thyroid problems. Now, if you remember back to what we have been talking about right at the start as well, some of these are starting to come across as those co-conditions of endo as well. So you can see how big in that stress state for a really long period of time actually can only exacerbate sometimes some of the other symptoms that we're experiencing as well. And then down on the other side, looking at that, things like chronic fatigue, chronic pain, anxiety. And, again, we're all listing those symptoms of endo as well with that. Now, when we're looking at strategies to manage stress, I mean, that's something I think Jenny and I could both talk about all day long, but really to summarize, we're wanting to be proactive and recognizing the signs. And it's kind of about giving yourself permission to actually consider stress and how that might be a factor in managing your endo as well. I think we all kind of know, we've heard of mindfulness and meditation and those sorts of things, but whether or not we actually practice it regularly is a different side of the coin as well. So mindfulness and meditation, it can be a formalized kind of practice, but it certainly doesn't have to be. So we don't have to be sitting cross-legged, really zen or anything like that. It's about being mindful in our day-to-day tasks. And you might find that just practicing walking mindfully and actually paying attention to the ground beneath your feet and the sounds that you can hear and kind of really zoning into that environment. Maybe it's sitting having your morning coffee without actually being on your phone or kind of taking in your environment around you, or even something as simple as brushing your teeth and really zoning in on that as well. But we do know that there are additional benefits to more formalized type meditation as well. And Jenny had a link to a wonderful pelvic floor relaxation. There's a lot of meditative ones that are related to kind of that pelvic floor relaxation, which is really wonderful. And you can get really specific with that as well. Adding joyful activities, I think, is really underestimated as well. So in our adult world, we don't often stop and kind of reflect on what we're actually doing that brings us joy, which is such an important part of our health and can really help get us out of that red zone a lot of the time as well. And then, like I said, that parasympathetic nervous system happens quite automatically. So there's not much that we can kind of consciously do to actually bring that down. But this mindfulness and meditation is one of them, and diaphragmatic breathing is a completely underrated form of that as well. It's one of the few things that we can actually do to help kind of bring us into that restful, that green zone state. And diaphragmatic breathing is quite as simple as actually breathing right into the bottom of your lungs as well. So when you take a breath, paying attention to whether you're feeling your shoulders rising up and down, which a lot of us are, and whether you can actually take that down deep into the belly and feel the ribs expand and relax as you go as well. So kind of just knowing there's a lot that we can do. It's about implementing these strategies intentionally with this as well. Now, moving on to our next pillar, which is sleep, which again links in quite closely with stress and probably sometimes isn't something that we think about when we think about managing endo. But really remembering that central nervous system sensitization and the pain science stuff that we've already talked about, it typically starts when the pain and the stress that results from it starts to impact our sleep. And this is when we get into this bit of a cycle. So we know the research shows that there's a really strong link between pelvic pain and sleep problems. And there's actually a bidirectional relationship because we know that a lack of sleep also makes our immune system more sensitive, which can increase our pain as well. So they're actually very closely interlinked as well. So you can see how women with endo kind of end up on this kind of spectrum where we're stressed, we're in pain, we're not sleeping well, and it kind of becomes this continuous cycle that can be really hard to break as well. And it's particularly when we fail to get our deep kind of restorative sleep, that's when it has effect on our body's healing processes as well. So our deep sleep's job is really for that healing and restoration within our body. And when these processes are impaired, that actually can affect our mood and raise our anxiety and continue that process as well. So I really like what Matt Walker says about sleep. He's a sleep scientist. He says sleep is a non-negotiable biological necessity. So if we're not getting enough sleep, that's hugely impacting every other process of our body. If you want to know more about sleep, he's someone that's definitely worth looking up here as well. So I really just want to make this point because if there's any women on here with endo that are considering good sleep to be a privilege, then you're doing your body a disservice by not kind of focusing on this as a strategy in managing your condition as well and getting some help and applying some strategies there as well. There's a concept called sleep hygiene, which basically means that you're having a bedroom environment and your daily routine that promotes consistent, uninterrupted sleep. So the image here outlines some things that are good not to do and some things that are good to do as well. We've got things like having heavy meals and other stimulants like caffeine and smoking and intense exercise before bed's not good for us. And we kind of know as well, we know being on our phones isn't necessarily the best thing for us right before we go to bed, but really the blue light is very powerful and we're constantly surrounded by, very bright lights at nighttime. So potentially part of your strategy might be actually strategically kind of dimming the lights a little bit at nighttime to help prepare your body for sleep as well. Now, the other things that are good for sleep is getting up at the same time each day, even if your body doesn't want to and you want to hit the snooze alarm. But what that does is it regulates that circadian rhythm that we have within our body as well. We also need a good bedtime routine. So that might be having a relaxing bath, it might be reading a book, whatever that looks like for you. It might even mean that you have to set an alarm to tell yourself when to go to sleep rather than, we sit up and get distracted by the television or something like that as well. And then we need a cool and a dark room. So our body temperature has to actually drop by at least 1 degree in order to kind of feel ready for sleep too. So considering that when you are getting into bed, that's why we have such a restless sleep in summertime if you're not in the aircon as well. So, they're just a few tips and tricks. Hopefully you can think of something that we can do to be managing that as well. Now, moving on to our fourth and final pillar that we want to talk about tonight, which is nutrition. So really, when it comes to endo, whatever you eat can either fuel the inflammatory processes that we've talked about, or it can help to minimize your symptoms as well. So you actually have a lot of power when it comes to this. And these are just a few nutritional strategies that we want to think of as quite empowering rather than restrictive, because they're giving you the opportunity to help kind of fight the symptoms that you're experiencing as well. So the fact that endo is such an inflammatory process with many characteristics of an autoimmune condition, we want to try and go for an anti-inflammatory style diet. So we want to, with our Western diet, we eat a lot of foods that are quite high in saturated and trans fats and a lot of refined carbohydrates as well. So if you think of basically anything processed, meat, biscuits, all of those sorts of things can contribute to that inflammation as well. So we want to aim for foods that are high in those antioxidants and the fiber and the healthy fats as well. So lots of, good fats, things like fish with their omega-3 fatty acids as well. And again, we want to consider that we have a lot of these co-conditions when it comes to endo. So if you're having IBS symptoms, you might have to tailor more of a low FODMAP approach. And that's where a dietitian can be a really important person in your care team to help you understand the way that we should be eating as well. It's also knowing, if you're experiencing bladder symptoms, there's a certain way that we can eat. There's certain foods that can trigger those as well. So that's where it really needs quite an individualized approach, and why there's not necessarily an endo diet that sort of fixes everything as well. So, along with your pelvic floor physio and your exercise physiologist, getting a dietitian on board is definitely very important as well. But really, the bottom line is that changing what you eat and how you eat can actually manage the inflammation that you're getting. It can help with the less than optimal gut microbiome that we often see with endo as well. And it can help with that upregulated central nervous system that comes with the condition too. Okay. So really just want to round up today with talking about your healthcare team, which I accidentally already started doing. So there's going to be a lot of people in your team when it comes to managing endo. The nature of the condition, like we've talked about, it affects so many different bodily systems. You're going to need a GP. You're going to need a specialist that actually specializes in managing endometriosis. You're going to want a physiotherapist that specializes in pelvic health. You want an exercise physiologist that also specializes and understands endo as well. Then we also want potentially a dietitian, maybe a psychologist to help manage the psychological component of that. Being on that misdiagnosis roulette can certainly pay its toll in that respects as well. And there's plenty more. We've only just touched on the outskirts of it all tonight as well. Okay. So just kind of knowing that you are the most important part, and having a team of good people around you is of utmost importance as well. So just touching on a couple of resources there. Jenny, do you want to attest to some of those?
Yeah. Okay, so we've put a collection of suggested resources here. Again, by no means is this definitive. So, but the Pelvic Pain Foundation of Australia provides a lot of really great resources relating to all types of pelvic pain. They acknowledge both teenage pain, women's pain, men's pain as well. So that's a great resource. They have a wonderful PDF document looking at gentle stretches for pelvic pain, both the internal pelvic muscles as well as external. So that's a great place to go if you're looking for some gentle stretches. They have videos on understanding chronic pain, and some information about some school education programs specifically for teenage pelvic pain too. So great resource there. Dr. Susan Evans, she is a gynecologist and laparoscopic surgeon and educator who has done a lot of work in helping to recognize endometriosis as a health condition that's put a lot of burden on the Australian health system and for women in general. And so she has a book called Endometriosis and Pelvic Pain, easily written, easily readable, which is a great go-to for understanding endometriosis. We both love Jean Hales for Women's Health. It's a wonderful women's health organization that provides really quality education for the public as well as health professionals on all things women's health. So you'll find a lot of resources there, including that period pains and symptom diary if you want to grab that. Endometriosis Australia, they do an incredible amount of work on patient advocacy and education, and in raising funds for research as well. What I'd love to tell you also is that Endometriosis Australia, if you go onto their website, then you can, and you go to research projects, they are actually recruiting for patients to be involved in quite a number of research projects at the moment. So if you are interested in being involved, then you can head there and pop your name down. So that's on Endometriosis Australia. Endozone, it comes out of Endometriosis Australia, and they provide many wonderful resources on patient management for the general public. So you can spend a lot of time looking at their resources and getting a lot out of it. If you're interested in understanding how TENS machines can be useful for managing pelvic pain, then Endozone actually have a great resource on that, provided by Fiona Rogers, who is a wonderful women's health physiotherapist who has done a lot of work helping to educate women and health professionals and pelvic floor physios on the use of electrotherapy and as well. So you can head there. And finally, Quendo is part of sort of the Queensland Patient Advocacy Group. They also provide a lot of education and support as well.
Okay, awesome. Thanks, Jenny. There's so many resources out there, really, isn't there?
Yeah, it's wonderful. There's the growing number, so that's fantastic. So, yeah, that comes out of particularly out of the 2018 National Action Plan for endometriosis that really wanted to. Is really think of it as a blueprint to tackling endo and trying to bring clinicians together, researchers together, women's health organizations together to be able to provide the public with more information and look at further research and things like that too.
Wonderful. And hopefully there just continues to be more and more of that as we go as well. Now, before we just put over to questions, I just really wanted to highlight you know, Jenny and I are doing this as part of Endometriosis Awareness Month, because really, you know, it's about creating awareness about the condition as well. So if you're wanting to know a little bit more about sort of what we do, you can see we've got the link to the website for both of us and how you can contact us to make an appointment. So you can see we've got Jenny's Facebook and Instagram on there, and also you can contact either via email or phone to make an appointment with Jenny to kind of discuss a bit more of a tailored approach there for yourself as well. And then for myself, there's the True North Wellness Facebook and Instagram page, and there's my personal professional one that you can follow. I'll post lots of things about women's health over time as well. And we do also offer a gap-free health assessment. If you're not really sure where to start or how exercise physiology can help you, it allows us to sit down and have a bit of a chat about your medical history, your situation, and start to nut out a bit of a plan together. And if you've got private health, there's no out of pocket, so you're not really losing out on that as well. We run a lot of different other programs, other women's wellness programs as well. And we'll send out a bit of a feedback form from tonight and find out if potentially that's something that you might be interested in as well. But yeah, thank you guys. I just wanted to, put it out to any questions for the group. Does anybody have anything that they wanted to ask? You can type it in the chat if you don't want to talk out loud as well. That's fine. Awesome. Thanks, Trish, for your comment in there as well. Thanks, Genevieve, as well. Certainly, like I said, we'll send out a follow-up email. So if you have any other kind of questions that pop up, then you can let Jenny and I know as well. But really just want to thank you for your time tonight. I know we could have just kept talking all night long. I think, Jenny, couldn't we? But we've taken up enough of everyone's time. But really hope you learned something about how you can, really take charge of managing this condition as well. Oh, we had Charlotte's asked a question. Thanks. Would you recommend a private or public specialist? Jenny, you might be a good person to answer that.
Gosh, that's I think that can depend on a few things in terms of location, budget, private health insurance, things like that. So referrals can be made to both public and private. I guess in terms of speed, then I've seen a specialist. Often a private specialist is quicker to get into. Yeah.
And really it comes down to having somebody who specializes in endo, because not all gynecologists are the same in that respect as well. So you'll get ones that specialize in it in both systems as well. So it's just finding the right person really as well. Yeah. Beautiful. Well, if nobody has any other questions, just want to say thank you for your time this evening. And if you have any follow-up questions, feel free to reach out to either Jenny or I. But really hope you learned something tonight, guys. So thank you so much.
Thank you.